Two members of the U.S. delegation agree to come and be with us and brief here this afternoon on the outcomes. We've asked them to try to cover the principal accomplishments and reflect on the process itself, reflect on what unfinished business there was, or what major issues that remained unresolved or moved in one direction, and what the next steps look like in terms of looking forward to September. We're also joined, fortunately, by several other folks who were present in Moscow for these two sessions, who have joined us here today. Paul Holmes from USAID. Paul, nice to see you here, who was from USAID, who's part of the U.S. delegation. We also have James Hospedales from PAHO. James, thank you for joining us. Laurent Huber from the Framework Alliance. Thank you for joining us. And Loyce Pace-Bass. Loyce, there you are. And so from Livestrong, Laurent from the Framework Alliance. So we have a very, very good mix for our discussion today. I also want to offer special thanks to my colleagues who helped pull this all together, especially Suzanne Brundage and Julian Noggle. This is being webcast. It'll be posted. It's being webcast live. It'll be posted on our site, and there'll be a series of podcasts on the iTunes University homepage resulting from this. There's a couple of really big questions that come out of this push towards the September high-level meeting and this major moment that has just passed in the Moscow Ministerial and the Global Forum. I mean, we're in a particularly difficult time right now, obviously, in terms of the global economic retrenchment and the austerity that many governments, either donors, middle-income, low-income countries face in budgets, and the uncertainty around the resource base that's available for different programs. And it raises one very fundamental question, which is how to begin to tackle a major new set of challenges which the NCDs present and integrate that into global health approaches, both at a national or an international or a donor level. How to begin to do that without big splashy new big money, and can you do that with or without hard targets or reasonable targets to motivate and judge and make measurements on what we do. So there's a big mega question out there that is certainly not been answered, but is one that I think guides a lot of debate and discussion around this. Another big question is there in fact a social movement forming around this issue? Because everyone makes reference to the UNGAS, the pivotal historical moment with the Durban meeting, the Durban IAS meeting, followed by the UNGAS meeting 10 years ago this June. And the fact that you had, over the previous decade, such a strong coalescence of a very unified and strong social movement. Here we have a different pattern in terms of a more complex and diversified set of constituencies and forming themselves fairly rapidly. And it'll be very interesting to hear the reflections from Yolanda and many of the other representatives of those constituencies as to how it is coalescing in terms of its agenda, what level of unity and purpose and longevity and sustainability is in that. Another is the question that is on everyone's mind is the translation of this set of concerns and emerging consciousness around NCDs into political leadership and financial leadership. Because the breakthrough that happened in the case of HIV/AIDS was a remarkable threshold of pushing into the heads of state and the finance ministers and the senior levels of leadership in societies that elevated this issue and broke it out of a predominantly health set of interest into a more strategic level. And are we seeing that in low and middle income countries? Are we seeing that in the other countries that are the rich North countries which face this same or a similar set of challenges on this? Obviously, there are many other debates around the prevention versus treatment, relative prioritization, the question about how do you mobilize a multi-sectoral approach. There does seem to be I mean, just reading the few accounts that came out, there were a couple of very strong impressions. One, that WHO came on very strong and made a concerted and very deliberate effort, and then Margaret Chan showed remarkable leadership and commitment, and very strong messaging that that there was, for the first time, to have this gathering at the Global Forum was itself a very strong signal of a determination to move in this multi-sectoral way, and that's terribly important. Where in the mix the business dimension fits is, of course, one of the really most challenging and difficult issues, too, given that the nature of this issue and the nature of the private sector and the business in trying to find solutions on this. So with just those brief words, I'm thrilled that we're all here. This is part of a series of events that we've had over the last several months, and many of you have been very generous in contributing your time and your thoughts. We continue to welcome your suggestions. We will continue to have a series of events of this kind as we roll forward and beyond September. And I think this remains a very important inflection moment in the preparations. And so thank you all for being with us. And let me just quickly do the introductions. Rosemary and Yolanda are known to many of you, I'm sure. Rosie is a senior advisor to the Assistant Secretary for Health at the Department of Health and Human Services. She has a long tenure at CDC as the Deputy Director of the National Center for Chronic Disease Prevention and Health Promotion over a 5-year period in multiple positions, particularly in tobacco and smoking control, going back many years, and has been awarded and acknowledged for her contributions over several years in those multiple positions. She has a Master's in Public Health and Master's of Science in Social Work at Columbia University. Yolanda Richardson is the Vice President for International Programs of the Campaign for Tobacco-Free Kids. She, previous to that, was the President and CEO of the Center for Development and Population Activities. Prior to that, when I first got to know her, she was Vice President at AfriCare. She was at the Carnegie Corporation. She's a lawyer, activist, gender expert, a prominent personality across a range of issues. So with those words, thank you both for being with us.
I want to say, this has been a pleasure to work on this initiative. I had the opportunity to serve on the WHO Steering Committee for the Ministerial, so had worked closely with WHO, and I've had the wonderful experience of being involved in a couple drafting sessions around NCDs, which I'm going to talk a little bit about what happened in Russia. So next slide. So I think that when we talk about this issue, and one of the key messages in Russia is that we always need to paint the picture for people so they understand the context. Why are we concerned about NCDs? And I've put that up there that we do have a major global burden of NCDs, and it is a strain on global economies. As you can see, as of 2008, we've had 36 million deaths. I think it's important to recognize that the determinants of NCDs lies in other sectors such as education, agriculture, transportation, urban development, and all of you are very aware of the fact that we have escalating costs from care and treatment of NCDs that are placing unsustainable burdens on national resources and household incomes. So I think it's important that we have those messages front and center. Next slide. So I wanted to brief you up a little bit in terms of what our key messages were as we went into the Moscow meeting, and I want to start first with we really have as a priority to emphasize the health in all policies approach. We think that's critical. We think that health sector has a critical role in all of this, but we need to be working with other government sectors if we're going to effectively address the NCD problem. We would want to highlight the need for prevention as a first-line response. But also, I want to say very clearly, and we talked about this in Moscow, particularly with the partner community, that we also want a clear focus on control. And when we talk about control, we're talking about care and treatment. A third area of interest is certainly creating sustainable health systems, and particularly starting with primary care. There's certainly, we will have to make some investments here. We're going to have to provide some incentives. There's a lot of work to be done to help the various health systems address in an effective way NCDs. Fourth, we want to emphasize the important need of addressing social determinants of health. And last and important is that we need to move from a vertical disease focus to a more comprehensive multi-disease approach. So those were the key messages from the delegation as we went into Moscow last week. Let me talk a little bit about the conference. All of you saw the agenda online that was published by WHO. What was impressive was to see 85 to 90 ministers in the room. Think about that for a moment. Across the world, we had 85 to 90 ministers from developed, middle income, and low income countries. I myself would have liked to have seen much more involvement from low-income countries, but we certainly understand their financial constraints in terms of getting to the meeting. But I think it was impressive that we had that type of presentation. In terms of the U.S. delegation, as many of you know, the Secretary of Health led our delegation, and we were very fortunate to have representation from people like Paul Holmes and our CDC colleagues, NIH, as well as from state, and Blackwood. And then we had representation from the private sector. And this is something that the secretary wanted, which I thought was really, really wonderful. And so we included the CEOs from the Heart Association, diabetes, as well as cancer, John Sefrin, Nancy Brown, and the diabetes representative was Larry Hausner. And then, of course, Yolanda was representing Campaign for Tobacco-Free Kids. And I thought it was just really great that we had such great diversity on the delegation. This was basically the structure of the meeting. There was the keynote address and plenary sessions, a lot of discussion about the state of the NCD epidemic, the challenges and opportunities for multi-sectoral actions to prevent NCDs is very much a central theme, and a lot of discussion about opportunities and strategies for international cooperation and coordination, a very key component of conversation within the ministerial. And then, of course, we had the roundtable sessions that really focused on the technical challenges of tobacco control, physical activity, obesity, research, surveillance, and then a real effort to identify the opportunities as well as make recommendations. And the structure was that there was a report out from each of the sessions in terms of concrete actions and recommendations, and that hasn't been published yet, but I hope to be able to see that in the very near future from WHO. And then there was the declaration, and this is sort of new to me. I always sort of tease Holly about this, but you get engaged with this, and so we've worked with the declaration prior to going to Moscow, and inevitably what ends up happening is we end up in very long drafting sessions, and that's what happened in Moscow. It was James is looking at me. We did this in Mexico. We did this till about 3 o'clock in the morning in Mexico. In Moscow, I think we were better organized, and we had good representation around the table in this drafting session that lasted for about 8 hours. Again, we had a lot of input from high-income countries. I would have liked to have seen more involvement from the middle and low-income countries. We did have, India was in the discussions, Cameroon was in the discussions, there was a lot of presence from the northern European countries. Of course, Canada was sitting there, England was sitting there. So we had a nice diversity. And what I have up here is the list of major issues that got raised during that 8-hour session. And you can see there were multiple issues. Some of them more contentious than others. I want to talk about mental health. I mean, there was a lot of discussion about including mental health and how, in fact, how can we be talking about chronic disease and not consider mental health as an important health issue that we need to address as part of our work in chronic disease prevention. There was discussion about this term non-communicable disease, and what does that mean? What's non mean? And should we be talking about the epidemic of chronic diseases? There's new language in the declaration about gender difference and a better focus on vulnerable populations. Very big focus on leadership at all levels, a whole government action. And there was discussion, and you're going to see language in there about engaging the private sector, working more effectively with the private sector. So they're working with government and NGOs around solutions in addressing the NCD problem. We have very clear language about accelerating the work around the implementation of the Framework Convention, strong encouragement to those countries that haven't ratified the convention. As you can imagine, there was some spirited discussion about international development agendas. There is language in the declaration. It's not the strongest language, but it's there. And really what it speaks to is international development agencies in countries making NCDs more of a priority. Lots of discussion about essential medicines and the importance of the provision of high quality, safe, accessible medicines, and particularly in the area of cardiovascular health, hypertension, and in diabetes. And then the issue of leadership from WHO was a lively discussion, and recognizing that WHO has really taken this issue and has provided very nice leadership, and Margaret Chin was very forceful and aggressive about immediate action and getting our work up and going around NCDs, but also the discussion around we need to include other relevant UN agencies. They have to begin to own this issue. And I think that's really kind of the charge to the WHO. And it was reflected that governments are interested in engaging around a multi-sectoral strategy and approach. We need to see that role modeled at WHO. So that was a big issue. The last issue, and look at the language carefully, is around comprehensive global monitoring framework on NCDs. That's the language that's in the declaration. This really has to do with targets and indicators. Some of you might know that WHO is currently working on targets and indicators, so it was a real push to get that done. I'd have to say that governments were comfortable with indicators, were somewhat uncomfortable with targets because of the issue of money. And having the resource base to meet those targets in an effective way. So that was a very, at times, difficult conversation within the drafting session. So the last slide. And I title this The Way Forward, and I want to be clear that this is my independent assessment in terms of what I heard and what came out of the ministerial. Clearly, a major focus on multi-sectoral action is critical to tackle NCDs. Clear call for political leadership at the highest level, both globally and nationally, with attention to implementing priority actions and interventions. And I'm referring here to the recent Lancet paper that lays out an understanding of what those priority action interventions need to be. Real focus on international cooperation as well as coordination to address NCDs in an effective way. at a national level, at a global level, scaling up priority actions and interventions for NCDs. You can see this is something that I'm very interested in, given that you see it twice on this slide. And then finally, I thought this was a very nice recommendation that many made, which is to strongly consider and incorporate the lessons learned from the HIV and AIDS experience, and that we need not to reinvent the wheel, but we need to be talking to our colleagues in HIV and AIDS and figure out the best way to move forward with our work around NCDs. So thank you very much, and I look forward to the discussion.
Thank you very much, Yolanda.
You want my slides?
Just, it didn't click?
Bottom right.
Great, thank you. And thank you, Steve, for inviting me to participate. I've entitled my presentation, Civil Society Priorities in the NCD Meetings, Progress or Peril, and I do that a little bit to be somewhat provocative, but in reality, I actually think that there is less peril and more potential for progress. So next slide. Rosie and I, when we talked about how we would sort of have the conversation today, we decided to sort of divide up a little bit. The bulk of my presentation will focus on sort of the global forum, which preceded the Ministerial, which was where NGOs came together to sort of talk about what NGO priorities were and how they wanted to influence the process going into the global Ministerial meeting. So I'll do a little bit on that and then talk about kind of what I think came out of it in terms of how the NGO has been talking about the non-communicable diseases and how we want to move forward and what we want to see happening there. As you'll see here, the objectives of the forum, as stated in the documents at the meeting, are all pretty much framed in terms of bringing together a diverse set of players, stakeholders, to have the conversation around non-communicable diseases. I mean, each one of the bullets has that kind of language about sharing, about multi-sector approaches and that kind of thing. And I think it, in fact, sort of is reflective of the learning of the UN community. For many years, and I can recall this going back to many years when I was working more closely with the UN, the decade of the 90s, where there was really a commitment to make sure that there was constant and continuous NGO involvement and engagement in discussions and conversations that were going on at the UN around development issues. So I think this forum sort of is reflective of the fact that the UN continues to learn. There was a blip in that sort of trajectory of including NGOs in the global development conversation and dialogue during the time of the development of the Millennium Development Goals. One of the big critiques that non-governmental organizations had was that that was a less than inclusive process in the development of the Millennium Development Goals. I think the HIV/AIDS experience is demonstrative for many reasons, because I think we then, after the UN unlearned what it had learned in the 90s, it relearned the importance of engaging the civil society and why that's important if you're going to have a sectoral approach to the problems that we face in terms of development. The forum was attended by about 300 participants. It was very diverse. There were faith groups. There were people represented by each of the sort of chronic diseases. There were broad health-based health groups. There were patient groups, and there was the private sector. So. If you look at sort of the slide that WHO put together that sort of outlines the preparatory process leading up to the high-level meeting in September, you'll see that there's really only two opportunities that are sort of formal opportunities for NGO engagement. The first was the one that happened in conjunction with the Global Ministerial, the one that I'm talking about today. That's one of them. And the next one will be in June, where the NGOs and the private sector will come back between now and the high-level meeting to, again, talk about the role that NGOs and the private sector can play in advancing and moving forward the global commitment around non-communicable diseases. Okay, so a little bit around the structure of the day, and I'll just do this briefly. It was basically an opening plenary, and then it was followed for the bulk of the day by concurrent breakout sessions. There was a reporting back period and then a final plenary where the key recommendations were summarized with the idea that whatever came out of that conversation would then be fed into the global ministerial meeting as a representative of what non-governmental organizations wanted. And then there was what one would say was the closing session. The breakout groups were interesting. There were 6 of them. 2 of them were sort of private sector in the traditional way in which we think about the private sector. It was divided roughly between the private sector that was more healthcare focused, and then the private sector, which was the food, beverage, and alcoholic services industries. There was a breakout session focused on health professionals and health services. Interestingly, there was a breakout session on the civil society, which didn't quite make sense because the whole meeting was civil society, so didn't quite get what that one was supposed to do, and I didn't go to it. But in any event, there was also researchers and academia who were a breakout session, and then there was a cross-government response. I actually went to the one on the private sector, and I won't talk specifically about that because I'll refer to that later in my comments. But you can see the breakout sessions were meant to try to pull together clusters of people to talk with a little bit more depth about kind of how they would see the role of each of these actors moving forward in the process. So next slide. So here's some key messages that sort of came out of that. At the end of the day, a statement was put together, and that statement was then shared at the ministerial meeting. And so here are some of the sort of issues that just came up during the course of this. One was, just not surprisingly, civil society actors called for urgent action in response to non-communicable diseases, trying to get it elevated, trying to make sure that there's really global understanding of the challenge that's faced by NCDs. There was really a call for the need to measure and monitor progress, and to do that against targets. We don't currently have targets now for this. Non-communicable diseases are not in the Millennium Development Goals, so NGOs really wanted to see targets be established. They wanted to see research that supported strong surveillance so that you could in fact have effective measuring and monitoring, and they wanted to actually have research that was also actionable, so that focused on sort of implementation, what's effective, so the governments could really get a handle on what they could do that was effective. They called for and challenged a little bit the role of the private sector, and I'll talk about this in a little greater detail later. But one of the things that was heartening, certainly to me as someone who spends their time on tobacco control these days, is that there was a pretty across-the-board rejection of the role of the tobacco industry in global dialogues and in global conversations around non-communicable diseases. There was great emphasis on the importance of strengthening health systems. I think this comes out of a lot of global conversation around capacity issues of health systems, most likely coming out because of the real burdens that HIV placed on health systems at country level. And so, again, a reaffirmation of the need that if there are going to be additional calls for implementation, that health systems need to be strengthened. And then lastly, of course, the money talk. NGOs called on greater commitment of resources and called on governments specifically to use some mechanisms they have at their disposal around taxes, specifically a call for alcohol and tobacco taxes. Okay, so these are now my observations. I've told you what sort of the group decided, but I wanted to just share with you a couple of observations I had coming out of the meeting. The first was that I thought I was actually fairly impressed with WHO's role and commitment, both at the non-governmental meeting and then the following ministerial. They really had done a fairly good job and had made the commitment to the NCD agenda, and that was really experienced at the highest level. Margaret Chan was there at the NGO forum. She stayed and spent the whole day. She gave messages and that were very nuanced, but also were very much in line with, I think, what civil society wanted and expected. She was very firm in her statements all throughout, I think, the 3 days that we were there together. As you probably well know, the WHO also released this global status report, which they themselves described as sort of a baseline document to give us good baseline information about what the current status of non-communicable diseases are, so that we were in a position to do the last thing which they've made a commitment to, which to put in place a global monitoring framework that they're hoping to release in July of this year. So I think that really, to me, reflected a real commitment of making sure that there was really complete global understanding, that Margaret Chan, as the leader of the organization, was visible, present, and on message, and that they're committed to looking at how to put in place a global monitoring framework. Next slide. I guess I would conclude that I think that from an NGO perspective, we achieved modest progress. And I say that because if you went into this sort of global meeting, and while there were lots of calls and demands for specifics of disease, of chronic diseases, there were some things that across the board, across each of the 4 diseases that were the priority for the global meetings, there were some things that I think NGOs said pretty consistently. 1, they wanted greater visibility. 2, they wanted greater accountability. 3, they wanted integration of NCDs in the development frameworks. And 4, they wanted financing. So if you talk about each one of those things in terms of raising the visibility of NCDs, I think we can sort of check that box off. The consultative process was quite robust. I think there is momentum for continuing to raise the visibility. The proof will still be in the pudding when we get there in terms of the participation of heads of state. But I think we can say that we've made some real traction there in terms of raising this as a global issue. In terms of holding governments and other development institutions accountable, I think, again, we've made some progress. There's progress still yet to be made in terms of that. The global status report made by WHO will help us all with the baseline, as I had indicated earlier, but I still think that we're going to have to figure out how to do this. Rosie made a comment in her earlier about, because the call is for multi-sectoral action, multi-ministerial action, what that actually looks like practically, as we all know, is quite complicated. It's easier when we're doing more vertical programming, but to try to figure out how you do that in a more integrated fashion is really going to require some real robust thinking and some real robust commitments about how governments currently do programming in their countries. The question about integration of NDCs into the broader development agenda, I think the good news from our perspective is that there is kind of no longer real debate that NCDs impact upon development. I think that's been, there's consensus about that. Now, how that then gets integrated into development programming, development documents, and how development institutions take that on is going to be a continuing challenge, and further conversations, in fact, going to be needed around that. And of course, around all of these meetings, funding always continues to be sort of the thing that will be, I think, that everyone will look to see how we really get our hands around how do you really fund prevention and control of NCDs. And I think we had some really candid conversations at the ministerial meeting. I participated in the group that focused on financing and talked about innovative financing messages, and I'll talk a little bit about that later as a separate observation. So next slide. Okay, role of private sector. This came up throughout the meeting. I think I, as someone who works on tobacco control, was probably particularly sensitive to it. But I think that the role of the private sector will continue to be debated throughout this process, leading right up to the high-level meetings and beyond. I think what I heard, and there may be others who had different sort of reactions coming out of that, I think I heard that we need to continue to be aggressive when it comes to the tobacco industry, because there could be the potential for slippery slope. The Moscow Declaration includes language about the private sector, so we don't want there to be any sort of confusion that that language somehow opens up the door to the tobacco industry being considered an appropriate player when we're having conversations about how to really deal with non-communicable diseases. So we were fairly vigilant about making sure that that language stayed narrow rather than expansive. I think there was pretty close to near consensus on the fact that the private sector that's engaged in the healthcare industry could play and has played historically a positive role in disease prevention and control. And so I thought that it didn't seem like there was much controversy around the fact that both private sectors who introduce technologies and medicines, and also who introduce medical technologies, had a role to play and should be at the table in ongoing dialogues. There does, however, continue to be skepticism about just the right role for food, beverage, and alcohol industries. You know, could they really play a role? The calls by those industries to look at voluntary rather than regulatory commitments remains controversial. I mean, I think all of us know that there are pros and cons of kind of how much people really, how they can truly be held accountable if those commitments are voluntary. So I think there's going to be continuing skepticism as we move forward about the role of those industries. Next slide. I can't let the day go by without doing some tobacco-specific slides. So let me just say what I think happened in terms of tobacco control. We were fairly successful, thanks in large part to a receptive colleagues on the U.S. delegation team in making sure the outcome document actually reflected a commitment to accelerate progress on the Framework Convention on Tobacco Control, and also to call on governments who had not yet ratified the Framework Convention to, in fact, ratify the convention. So we were pleased to get that language in there. We were also, again, pleased to get language in that sort of narrowed and made sure that the private sector language was not expansive but narrow and did not include the tobacco industry. And then lastly, I think a win for the tobacco control community was just that the Global Status Report really kind of highlighted why tobacco control policy change is a really good buy. First of all, it's cost effective, and 4 out of the 10 best buys in the Global Status Report are tobacco control policies that are represented in the Framework Convention. And then lastly, kind of what's needed in terms of next steps. I think the real role for non-governmental organizations is to do what we have been doing so far, but going forward to continue to do that. Advocacy will be critical. We will have to, as non-governmental representatives and civil society broadly, do what we do best, which is to continue to try to express what we know and understand by engaging with a broad cross-section of people and making sure that governments hear that. So we need to do that at the national level and a lot more at the national level, I think, with national governments both in country, but those delegations when they get to the high-level meeting and in preparation for the high-level meetings. And then at the global level, I think it's really important for us to kind of, again, remain vigilant, be present, and participate in those conversations and dialogues so that the issues that we care about continue to get reflected in whatever comes out. Lastly, I think I would just sort of conclude by saying I think that, you know, critical next steps for us is to really get our hands around what it really means. There's lots of language that requires greater definition, whole of government, you know, what it means to really integrate NCDs even into the health sector, let alone into the development agenda, and then continue to grapple with countries and hold national governments accountable. I'm sort of torn by this notion of kind of where we end with financing. On the one hand, there's some real tools that can be used at the national level, and governments ought to use the tools at their disposal, and then the question just becomes how much more does the international community need to weigh in to provide greater support for what national governments can do to be able to finance their commitment to eliminating non-communicable diseases. So with that, I'll stop.
Thank you. Thank you both. It's interesting that neither of you talked much about targets, which, you know, remain fundamental to trying to set some metric for progress and a way forward. You did mention sort of the hope or ambition for some kind of monitoring and evaluation either by governments themselves or by independent means. Maybe you can say a little bit more about that. This whole quest for a multi-sectoral approach remains somewhat murky when you get down to sort of the appeal for this. Okay, how do you operationalize that?
Talked about that earlier.
And the business sector, getting the business sector more deeply engaged as to, okay, what would the 2 or 3 top opportunities look like, or the key steps for doing that? You know, how do you move that skeptical range that you talked about, the food, beverage, pharma, if that's you know, how do you move that category into the to the table and become more deeply engaged? I mean, it does seem like, you know, as we look towards September and beyond, that, you know, this is not going to be a movement likely driven by donors and by money. I mean, donors will be part of the equation, money will be part, but it's not like there's going to be large external flows or that it's going to be donor driven. The social movement, civil society piece is going to be important, but also it's still a nascent movement. It would seem to me that a lot of it comes down to breakout countries that embrace this and move it along at a national level in terms, and some have already begun to do that in terms of making this a priority at a national level, beginning to talk about taxes and regulatory environments and incentives and cooperating. And maybe you could say a little bit more about, as you look at the spectrum of countries, and maybe when we move to our other folks like James and Loyce and Paul and Laurent, sort of where are we likely to see the leadership coming from? Because my own feeling is it's going to be coming from countries that begin to feel increasingly the acute threat of this, and their political leadership translates that into it becoming a priority and moving it forward. Businesses are likely to become more engaged too, because there's going to be money to be made in this sector. And so how do you capitalize on that? How do you begin to tap that interest? And also businesses are feeling pressure. I mean, the food and beverage community is feeling pressure about reputation. They don't want to be on the wrong side of, I don't think it's not in their business interest to be seen as on the wrong side of this, as selling foods that have adverse consequences. And so finding those solutions, and pharma certainly doesn't want to be seen as blocking affordable access on adequate treatments. So maybe if those are big issues, I realize. Maybe I can bring it back and ask you before we move to some of our other delegates or participants. Maybe you could just start by saying, did anything that you hear there really surprise you in a way that when you went there you weren't really anticipating you were going to hear or see?
My impression was, I wasn't surprised by anything that I saw there over the week. I think that the drilling down around multi-sector engagement and making that happen in a real way, was a big part of the conversation. I think the target issues is a difficult one. I think that there was clear recognition that we needed targets, that we needed to be able to hold governments accountable. I think that there was certainly a call that governments as well as global international organizations all need to come to the table if we are to be effective in terms of addressing the NCD problem and meeting these targets. So I think the target conversation is pretty much ongoing. The Director General did say very clearly that she expected to have indicators and targets by July. So I'm very curious to see that. I know that we within the U.S. have some representation on the working committee. So there weren't things that I thought were surprising, but it was good to see that we had some real enthusiasm around the work that needs to be done around NCDs.
Yeah, I would agree. I think that the target conversation, WHO will certainly lead that when it comes out with its assessment of sort of, what the global framework will be. So, I think that isn't an immediate concern for me. I think that conversation there's openness to that. It's definitely, the door is not closed. I was sort of struck, Steve, a little bit about your question about sort of where's the leadership going to come from. And I must say, I didn't leave the room at all clear about who are going to be the players that are going to really be the leaders on this. I'm tempted to say, that if you look at where the countries are that have been the leaders in tobacco control, and I just say that just because both is a field that I know, but also secondly that I think because they've already begun the process of trying to deal with non-communicable diseases, that may be the first they may be the first string. Countries like a Uruguay or a Finland. Or even a Turkey. If you're trying to look continent by continent, there are some real stars out there in terms of who've been the most aggressive and gone the furthest in terms of tackling that. those would seem the obvious candidates, but it is sort of disturbing to reflect back on the day and not see any one country sort of.
And what about, I mean, the one head of state who was there was President Putin.
Mm-hmm.
What was the outcome of that, of his intervention?
Well,
Other than you waited around a while.
yes, we kind of waited around for a while for the Prime Minister to show up. So I think that it was, clearly he was enthusiastic about making a commitment and investment. He actually talked about the kind of resources they were going to put into NCDs, which was surprising. Like it was good to hear the commitment. I mean, we basically heard about the kind of work they're doing through their clinic system, that kind of thing. It was good that he was able to be there to address the ministerial, and there was a real call for him to participate at the high-level meeting in New York. I don't know that. It'd be interesting to see as countries go back from the Moscow meeting what kind of success they're going to have in terms of getting their heads of state to New York. Because I think getting the heads of state to New York is going to be critical if we are to move forward and we are able to see some type of sustainable commitment toward this work. So that's going to be a real test for the New York meeting.
I'd like to ask some of the other personalities here who were in Moscow to comment. James Hospedales from PAHO. Many of the member states of PAHO are actually leading in the response and the formulation. Can you offer your thoughts?
Thanks, Stephen. Well, I think the Americas region and the European region are the worst affected by this problem of NCDs and obesity. And the initiative for the summit bubbled up out of our region, the Caribbean in particular. So one would hope that the Caribbean countries will continue this leadership. And in New York, they have been very much at the forefront of raising awareness among the permanent mission, the permanent representatives. And that's important. While we're talking here, there's still New York and the delegations that will be involved lag behind in their understanding of this. And it's reflected, I think, too, in the broader UN community still not being sufficiently involved. So just last week, we prepared a briefing for our director to engage with all the regional directors of the UN, which he did 2 days ago. And we're sharing that with all the other WHO regions to give them some equipment to do that. Reflections, well, the first day, as was commented, to me was the most interesting day, because the conversations on Thursday and Friday we hear over and over, we talk to ourselves. Some evolution and some building of the global commitment, but the Wednesday was the most interesting day because, and I really appreciate Dr. Chan's leadership in saying we cannot face this problem alone. Government, civil society, business have to work at it. And that was a strong signal and a good signal. And I think where we're talking about, for instance, the private sector, we have to what's the word? Segment the private sector. So tobacco is a pariah, agreed. But to lump food and beverage and alcohol together is a little, alcohol you can do without, tobacco you can do without. We have to eat. Most of the food we buy and most of the stuff we drink actually comes from the private sector. So I'll be provocative and say they have to be involved. I have no difficulty with that. They have to be engaged. But then you have sports, you have information and communication, entertainment, insurance. A lot of other pieces of the private sector weren't there and need to be there in an all-of-society response. I was really impressed by some of the commitments of NGOs. I thought you were going to mention that. World Council of Churches said, we can do this. Consumers said, we can do this, we can do this. I thought that was really great. And I tried to persuade Sanya Nishtar, who was chairing that session, to capture that and to record it. Because jumping to accountability, and if we say it's a multi-sectoral problem and you need an all-of-society response, then thinking ahead to the accountability mechanism, it may not only be governments that have to be held accountable, but all of society. Sure. What's the International Chamber of Commerce going to do? What's the World Economic Forum going to do? What are the faith-based organizations? What's the church going to do? The Catholic Church, there are 2 billion Christians on this planet. What are the churches going to do? And that'll be new, that'll be novel. In confronting a major problem like this, how do you construct a joint accountability matrix that holds not only government accountable, but other sectors accountable. I think that's one of the exciting things, given where we are. In terms of leadership, which will be critical, this is from study of other, and one of the things we've been doing in PAHO is we've put some resources into studying other summits. How do you control something through summitry? Which is what we're trying to do. So we've been working with the G8 and the G20 research unit at University of Toronto. They've been studying summits for 20 years. How do leaders take decisions? And it's not only based on nice technical targets. They take political decisions. We saw that in the Caribbean. We've studied the CARICOM summit about where you place the commitment, the kind of language, what heads will sign up to may not always be beautifully evidence-based. They may think, oh, this is a really good idea. Are we going to do that? And that may have more success than some technical target. So I think the leadership will be important. In our region, we're looking at Brazil. Brazil's president, who was campaigning on chemotherapy. Many people may not know that, but she was. And one of her first public policy acts was to make medication for diabetes and hypertension free. And one of her major second policy was just 3 weeks ago, where she launched a major national campaign on dietary salt reduction. Not the Minister of Health, the President. So we're looking at her. I mean, she's one of the BRICS to be a champion. I think Russia should be one. India and China. India and China are sitting on time bombs where this problem is concerned with their populations. So those, Indonesia was the one that got the one clause about NCDs into the last G20 communique out of Seoul, was Indonesia. So, and they're a big country. We should be looking at them to that. Looking beyond the summit, and I'm not necessarily completely logical in my comments, but looking at next, we will not achieve everything in this one high-level meeting. History shows it's going to be an iterative process. Mm-hmm. And looking at the G8 and the G20 and the Summit of the Americas and APEC and CHOGM again in our region next year, the Americas region, we have to also look at those as leverage points for achieving things that are needed. My last comment is, at this point, is that you were talking about the U.S. government perspective on health and all policies. That's important, prevention, stressing that. But some of the countries really face a public health emergency. They are being overwhelmed by hundreds and thousands of people with renal failure and diabetes and heart attacks. And forget about development. I'm being provocative here again. Forget about risk factors. What do you do with hundreds of people turning up and overwhelming the hospital? What do you do? In El Salvador, half of the main hospital is renal failure, and half the budget of that hospital is renal failure. In Honduras, we were there a year or two ago, 50 new women every week coming for radiotherapy for cervical cancer. That's a complete failure of primary prevention, of screening. Every week, 50 new women, and a lot of them are young women. So countries really, in Ecuador, some of our team that was there last week said they're overwhelmed by sick people that need attention. So this is an urgent piece of the epidemic that while the prevention, and so it's both. You need to work on the prevention and the determinants, but we have an urgent issue of people who are sick and dying to attend to. I'll stop, thanks.
Great, thank you. Loyce.
Thanks, Steve. Hi, everyone. How are you? So yeah, I was there along with the rest of the crew in Moscow, and I actually have we were a motley crew, of course. But I have a slightly different perspective, just being from an NGO and being from a cancer organization, but really speaking on behalf of civil society, I think I was surprised by a few things. And of course, in the session that Yolanda did not attend, thank you very much. We presented on civil society and what we could all do. And there are a few things that struck me. First of all, I was really delighted, as James mentioned, that NGOs stepped up to make commitments, because I think from our standpoint, we really don't see this as a government problem. We really see this as everyone's problem and everyone's solution in that regard. So that was really just exciting to see people stand up and say, this is what we are doing, this is what we will continue to do. One thing, though, that concerned me was that I still felt as though we still don't have a clear idea what and who we're talking about when we talk about NCDs. We don't have a brand. We don't have a red ribbon, a quilt, whatever. And we need that. And I think we can all talk in these rooms about what needs to be done, but it doesn't matter. If it's not relevant to the general public, then we really won't get anything done. And so at Livestrong, we stood up and talked about our commitment around really changing the face or putting forth the face of NCDs, selling the story, not just telling the story. And so I still think that that needs to come forward a lot in our discussions as well, as important as it is to talk about, the burden in numbers and facts and figures. I mean, people still don't see a face. And so I'm happy to share with folks some of the things that we did. I think our presentation is actually going to be online at WHO's website around the face of NCDs, but that's just something that I really urge all of us to try to work towards. And I will say, because I don't think anyone's mentioned it yet, you do have groups like the NCD Alliance, like Global Health Council, trying to coordinate civil society so that we are all speaking with one voice and putting forth the voice of the patient or the survivor, and also speaking with one voice around what needs to be done. Because that was another takeaway in Moscow. I still felt like we were a bit uncoordinated, and that was really, it was very stressful for me because there are a few of us in the room who've been working at this for the last 2 years, and so to be 6 months out and still feel like we really don't have it together was really a bit disturbing, I have to say. And there were ministers, and even one of the co-chairs for the UN Summit made the same comment, basically saying, civil society, get your act together. So I would really urge all of us to really think about that. I think we're doing a great job, considering we had to really hustle and get together really rapidly for the summit. But I just, I have to say that to have people still standing up and talking about, other NCDs that haven't been included yet, and that we need to move on. It's the 4x4, it's the 4 risk factors, it's the 4 diseases, and we have to get to solutions, and we have to be putting those forth to our government so they know how to act. So that was number 2. And the final takeaway for me was, Rosie touched on this as well, I really appreciate that, people really started to bring it back to a balanced approach of prevention and control. There's a lot that's put out there in terms of prevention because we have the excellent models of, say, tobacco control, and I think that's very important for us to draw from. We also have really clear solutions in terms of treatment and healthcare access that really weren't highlighted as much. And I don't know what we need to do to put those interventions forth. For example, what was done in the Lancet framework, but we need to be talking more, even if it's just about cervical cancer early detection and treatment. I mean, you can screen and treat on site. You have a vaccine for cervical cancer. You have morphine for palliative care that's being used in HIV/AIDS settings. Those things weren't talked about. And so I worry a bit about the imbalance, and I think moving forward, we need to be sure we have a balanced, comprehensive approach using solutions that we know exist.
Thanks, Dave. I'm going to stick with your surprises theme, if that seems to work. And thanks also to CSIS for continuing the conversation. I think it's really important that we do this. In terms of surprises, number 1 surprises, we had 4 days of glorious spring weather in Moscow.
That is true.
That just doesn't happen very often. The second surprise for me, I guess, is indeed, this was a big deal. I've been to a few international conferences before, and we had, 170 countries represented, 90 at the ministerial level. That is quite remarkable for something along this line. And I think it really, to me, illustrated how seriously people are really beginning to take this. That would not have happened just a year ago. It could not have happened a year ago. So that was a big thing for me. The African countries were actively engaged across the board. I had only a few conversations because of other things, but it was really, really clear to me. So we can no longer say that it doesn't matter to Africa, and that it's just a question of Latin America or Europe and Eurasia. Many of the people, NGOs and others, wanted the Moscow Declaration to go further. I wasn't surprised that it didn't go further. There was a remarkable degree of, a lot of donor countries, not just the United States, were a bit cautious about making commitments for the very reasons that we've discussed. And that, at the same time, I think they came away with it with a sense that here are the areas that we need to continue the discussion on, continue the dialogue on, and continue to do work on between now and September. It wasn't a surprise, but I think it was a marker for donor countries of work that still needs to be done. A new theme for me personally was the fact that low and middle income countries don't need to be looking to donor countries for their solutions. There are all sorts of things that they can begin to do work on now. They've got legislative tools, political tools, communication tools, etc., that they can use. Yes, we will need some work in terms of technical assistance and ramping up action plans and so on, but there are indeed things that low and middle income countries can begin to do now. It's not yet September. Is another theme that came back for me. June and July are going to be critical discussions. There is a broad group of stakeholders at these various meetings, representing all the groups that we've talked about. Tremendous diversity of interests and economic, political, ethical interests. Each of them, I think, comes back from this meeting with a sense that they still need to be engaged with their legislative, political, and executive branch officials, particularly in the June-July period. In terms of leadership, I was really struck with Dr. Chan's leadership. And I've been in a couple of meetings with her previously, but she's remarkably determined, and that determination came out. One of the more poignant moments for me was when she almost literally twisted the arm of Prime Minister Putin regarding tobacco and participation at the high-level meeting. And one does not lightly twist the arm of Putin. So
Get a smile.
And get a smile. So she is not going to be relenting on her commitment and WHO's commitment for the next couple of months. In terms of leadership as well, I would like to highlight and recognize Secretary Sebelius. She gave 3 days of her extremely busy schedule to spend in Moscow, primarily, though not exclusively, devoted to this issue. That's a huge amount of time coming from her. A lot of it was on tobacco. A lot of it was related to the U.S.-Russia bilateral programs, which also have healthy lifestyle elements associated with it. But clearly, DHHS is going to take some leadership going forward. The other point on the leadership is that leadership is coming from all sorts of little places. And I don't mean little in a pejorative way, but unexpected. The youth are coming together. I saw something online recently about a group of medical students that are forming. We've got not just about specific issues, but really coming together and beginning to aggregate in ways that we would never have seen previously. I'm going to stop there. So I guess, except to say, it was, with your question, a week of surprises for me, and I didn't even realize it.
Thank you very much. Laurent.
Yes. I'll definitely try to not repeat what everyone has said at this point, but I think a critical point for us is that this was a meeting of health ministers. As we move forward, we're going to be having different interlocutors, and it's going to be a bit more difficult to get support. So while we had some modest successes, I expect that it's going to be a bit of an uphill battle. I wanted to get back to the point that Loyce made for civil society, and it's true. I mean, we're dealing with 4 constituencies, more than that. We have 4 diseases, cardiovascular, cancer, chronic lung diseases, diabetes, and 4 risk factors. Then we had also the mental health issue and so on and so forth. The list of asks was humongous, was huge. And when you look at it, at what all the different constituencies were asking for, it's very costly. And governments want no-cost interventions in today's economic crisis. So that is a difficulty. It's one advantage we have in the area of tobacco control, where we have not only a treaty, which governments are accountable to, but also a lower cost intervention. So at least in that's one area where civil society had maybe a bit of civil society involved in tobacco control, a bit of a better advantage. And it was easier to have clear asks. And what we noticed there is we were able to actually get changes to the outcome statement that came out because we had clearer asks on tobacco than we did on others. It was easier to negotiate with governments. But we need to address that issue of the costing. On the targets, I'm sure all of you are familiar with the Lancet paper, and WHO did release at least some objectives by 2025. Those are public, right? Oh, they're not. Okay. Well,
I don't think so.
okay. Well, because
Coming along.
okay. So some of us have seen those, and there are a set of targets which are fairly congruent with the Lancet paper, which I can pass around for those who are interested. But time is of the essence. We met, for example, some of the key facilitators to develop the zero draft, which is the one that will be adopted in September. We have until mid-July to influence this process. That is not a lot of time. And we don't really know even who really owns this at the UN. It's unclear to a lot of us, and we've been following this for a while. Is it going to be, who within the UN? We know the key facilitators, we know Jamaica and Luxembourg. But is it the DG's office? Is this the President of the General Assembly? Where is it at right now in order to be able to better influence this process? My last question is we had some modest gains in the issue of development and linking NCDs to the development agenda and making sure that FCTC implement or any of the NCD issues are linked into subsequent successor goals to the MDGs. And there is resistance to this. While some low-income countries were supporting this, some countries, including the U.S., will oppose this at this point. And the argument we hear as well, we don't want to divert funding that we have already earmarked for ongoing projects. We don't want to divert that. We don't want to go back to our parliaments and try to get more money for future projects. However, it seems to me that it's critical if we want to make a difference that NCDs are linked to the development agenda, that we measure development by measuring also NCDs related objectives and targets. And while I understand that governments don't want to add additional reporting burden, how could we do this? And specifically with the U.S. delegation, which I believe was not too keen on having some of the strongest language that even some of the low-income countries seem to have wanted to have included in the draft agenda, in the declaration.
Thank you very much, and thank you all for being so patient. This has been really quite illuminating to hear from the six of you your different perspectives, and there's several sort of cross-cutting themes emerging. What I'd like to do is open things up and invite comments and questions from the audience, and maybe what we can do is bundle together three at a time, and if you want to direct your comments to a specific panelist, please feel free to do so, and just quickly sort of identify yourself and have a quick intervention, and then we'll go three at a time and then come back to our panelists. So just put your hand up, please, and use the microphone.
Rebecca Firestone from PSI. I guess I'm wondering what the next steps are for the U.S. delegation in leading up to this summit. I was struck by the breadth and nuance of the messages that you had for the delegation in the ministerial that just happened, and how that's going to translate into U.S. government role going forward, particularly in terms of development assistance, both on the financial end and on the technical assistance.
I'm Lisa Carty from CSIS, and I actually just have a question on the health system strengthening theme that seemed to run through. Rosie, you mentioned it as a part of the U.S. delegation's specific objectives, and then it seems like it came up in the declaration itself, and we know that's been a challenge, in both for many bilateral programs, but also for governments themselves. So, we've tended to talk the most about health system strengthening in the infectious disease context, and I'm wondering if there was any more specific discussion about how to link the non-communicable disease and the infectious disease discussions around health system strengthening in a practical kind of way.
Nalini Salagram from Arogya World. I was just wondering, there have been so many declarations and outcome statements, and I was just wondering who actually, did the drafting committee actually read those? And, what happens to all these various documents?
So we'll start with those three. Rosie, do you want to start off?
Sure. Well, we're grouping at this point. I mean, we've learned a lot from both Mexico and Moscow, and we're going to actually sit down next week and have a conversation with our leadership about next steps. We haven't made any final decisions in terms of how we're going to approach the UN meeting. Clearly, I think the overarching principles I put up there where we stand behind and continue to be supportive. But Holly and myself and Niels Dallaire, and in conversation with the secretary, have to figure out what next steps look like in terms of moving forward to New York.
Okay. Other comments? Paul?
If I could, I will add just a few comments to that, Rosie. Because this is a UN high-level meeting, the Department of State, through its Bureau for International Operations, actually takes the lead on that process. And they play a convening role, and they will help us all to kind of identify the issues and figure out ways to work them through, everything from, who's going to lead the delegation through development questions along the way. I would just emphasize on the health system strengthening point. Yes, indeed, an awful lot of attention to that. Most of the attention had a caveat with it. Wasn't just health system strengthening, but it was integrated primary health care system strengthening. Basically emphasize that it needs to be a patient-centered kind of approach dealing with people when they first go into the primary care unit.
James, you wanted to say a word?
Just in relation to Nalini's comment, the modalities resolution of the UN specifies the format of the high-level meeting, but also what builds into that. So the resolutions from the 6 regions, the interactive hearing with the NGOs and private sector in June, these formally have to feed in. They must take account of them and look at them quite closely in preparing the outcome document. This is new. NCDs is new in the UN agenda. And where it's new, it could go bad, or it could be a chance for new creativity. I hope the latter. But just that to answer your question, we're trying, from PAHO point of view, we're trying to do one other input, and that is to we'll do a briefing session on June the 15th over the luncheon period in New York for lessons learned from other summit processes. Some of this research we've been looking at, and we'll offer a brief. The CARICOM group will sponsor that. We're looking for another co-sponsor, maybe India, maybe another big Bangladesh, another big country. So that's June the 15th. Well,
It's more than those, WHO region declarations. There has been something from the NCD Alliance, from the Global Health Council, the Youth Manifesto. There have been so many. Are they all being collated in one place? I was just wondering.
Yeah, there's the modalities resolution, which doesn't take account of it. It didn't have Moscow on it.
Right.
But they will take those into account. If I may, I think a lot of it, NCD Alliance, Lancet, is still very technical medical public health. We have not yet sufficiently try to frame things the way world leaders will, which is a political point of view, and we're still not quite there yet.
Laurent.
Just on the same issue, there have been a set of meetings. There was the first one, I believe, was in Melbourne last August or September, and then a set of them in the regional consultation that led to the resolutions. The Moscow meeting initially was not supposed to be a fitting meeting, but it ended up by de facto becoming a fitting meeting for the summit. And then also, as Yolanda was mentioning, the June civil society hearing. And our understanding, and we hope that no one is lying to us on that, but that all of those would be taken in consideration by the key facilitators in developing the first zero draft. And our understanding is that that zero draft would be done in consultation between WHO, key facilitators. Is that correct? And then it would be going through the UN system, and countries will basically negotiate through mid-July, we expect. And then after that, it will be harder to influence the document.
Thank you.
Did you want to weigh in?
Yeah, I'll just add one more thing on health systems. I think, Paul touched on how it was largely focused at the primary care level. I think also one thing we could think about is how NCDs present an opportunity to help define health system strengthening, because I think we have been struggling a lot with that. And Julio Frank, offers a really great example, and I'm sure many people have heard him speak about the diagonal approach, but, using an NCD to achieve all of those goals, the pillars around health system strengthening could be really useful, I think, in a way that not just only helps NCDs, but also communicable diseases. And so that's a way that us at Livestrong, we at Livestrong are approaching it, and I think that's the way that the NCD Alliance more broadly is thinking about it as well. So just wanted to add that.
Thank you. We had a question over here, Katrin, and then over here and over here.
Good afternoon. Yes, my question arises from Rosemary and Yolanda. Both of them mentioned something about low-income countries. Like Rosemary mentioned, some of the countries, they didn't come because of financial issues to come to these meetings, and Yolanda also mentioned about how the tobacco, some actions has to be taken regarding the tobacco companies. Yes, of course, like the low-income countries, they are in shortage of money, they have it. And also the tobacco companies, they take advantage of it because it's when they want to open their, because they are losing business in the West, in the developed world, and because of some interventions, you cannot smoke in this area, you cannot smoke in this area. So also education matters. Here in the West, they are giving adequate informations. But also the epidemiological transition also moving in the developing countries from communicable to non-communicable nowadays. More dies on non-communicable than communicable disease. So is there a way to stop that, the tobacco companies business by doing, for example, PEPFAR or PMI gives money to third world countries, they use it efficiently to their cause. But if we do that, and at the same time, if a government, let's say Kenya or some other countries, they open up a cigarette tobacco company, they should not get also the money, donate money for these NCDs, because they cannot play both. That's my comment.
Hi, I'm Kimberly Reed with the International Food Information Council Foundation, and I appreciate James and Paul's comments on effective communication. So when we're looking at a cost-effective way to help move consumers around the world, effective, simple messaging is what we care about. So I sent letters to many of you, but please just keep our organization in mind as you move forward. We want to be helpful so that consumers know what to do.
Hi, my name is Yulia Spanchuk, and I'm from the Hudson Institute. I don't know. It's on. Hello? There we go. Hi, I'm Yulia Spanchuk, and I'm from the Hudson Institute. My question is about the role of pharma in this issue. Pharma played a huge role in terms of drug supply for HIV, AIDS, and malaria, and I assume that it would play a huge role in terms of specifically cardiovascular diseases. And so, was there a pharma representation, and what will be the role of pharma in drug supply?
Let me just answer quickly the sort of tobacco company and whether there should be conditionalities in terms of their ability to participate. This sort of question came up a little bit in terms of this notion of setting up a global fund for out of which companies would tax, and then they would then be using the resources from that to help countries implement their programs and strategies around non-communicable diseases. I mean, I think that, Africa is an interesting, region in the sense that, it is still probably more than any other region going to be having the dual burdens of both infectious diseases and non-communicable diseases, and also where the vulnerabilities are quite substantial in terms of the possibility for tobacco industry influence, just because there's a huge development agenda and tobacco industries can in fact come in and say, we're going to do corporate social responsibility programming. I don't think we need new modalities for that. I mean, the Framework Convention is actually fairly strong in terms of, for countries that are signatories, most of whom are a lot of African countries are, about how governments can in fact interact with tobacco companies. So I don't think we need to apply new conditionalities. I'm always hesitant about, forcing countries to, go through additional sort of hoops to get resources to move their development agenda. So I think if we implement and hold countries accountable in terms of existing documents and frameworks, will already be there.
Thank you. Laurent, did you have a comment on the question raised about tobacco?
Tobacco, yeah, and I would just suggest for a lot of those countries just to apply WHO's recommendations to implement fiscal policies such as a 70% excise tax on the retail price versus having some type of agreement with the industry, which could then be used for a corporate social responsibility type of agendas.
On the pharma piece, I wanted to respond that yes, pharma was present, as were medical device companies, and so there was a separate roundtable actually on that industry that everyone attended, but that there were quite a few speakers at, and that was really I heard it was actually one of the better sessions, it seemed. On the topic of drugs, since you raised it, I do think that one thing to keep in mind is that there are a number of generics and off-patent drugs that we need to consider, not just in terms of cardiovascular disease, but also diabetes, cancer, I mean, the spectrum of what we're talking about here. And that's something that we need to continue, I think, to put forth so that it doesn't become an issue of, sort of brand names and IP issues and all those things that people, I think, are trying to avoid in some cases. But, there's some real easy, even cost-effective solutions when it comes to providing technology and pharmaceuticals.
Let me just mention, there was a very, very good session at the Ministerial Roundtable on essential medicines, and there are some very innovative practices that are out there right now around NCDs that have very strong potential and a real focus on pushing out on safe and effective generic drugs, particularly in the area of diabetes and cardiovascular health and hypertension. So there are some nice models that we need to look at very closely.
Yeah, I'd like to make two slightly different comments, on one on messaging and the other one on money. I think when you look at the success, what constitutes success for former summits, media and communications and messaging is critical, and we're not there yet, and this worries me. We have a branding issue. We don't have a buzz out and among the general public and in the press, and this is an urgent piece that's needed. WHO has finally, just 10 days, 2 weeks ago, came out with their initial 6 key messages, 2 of which are mostly directed to the public and for policymakers. And those get attention. Beyond that, we need a second and third generation of messages with specificity of what policymakers need to do. I see Roger here, I see Frederic, 2 private sector companies, there may be others, but we really could use some help from communications companies. Why doesn't somebody step up on pro bono, offer to brand NCD, like we have KFC? Nobody knows anymore what AIDS means, acquired immune deficiency syndrome, but everybody knows AIDS. And in the Lancet group, we've been talking a bit about that, just getting a brand for NCD. And it's possible, you can do it, but it needs doing, and it needs doing urgently, and then linked to the messaging, and get media and communications companies on board. We're not there yet. And if we go to, we want leaders there. We want them to act. They will act when there's some groundswell of public opinion, and that worries me that so that not worries. We have to address that. The second is on money. looking at other summitry and looking at the CARICOM summit, the countries that were a bit better off did manage to do things. They implemented a lot of the 27 commitments they made. But the smaller, highly indebted countries did not implement very much. They just don't have capacity. That's one. Second, existing donor frameworks and engagements on health are channeling them to not look at NCDs. And that's not fair. It's not fair that USAID and CEDA and all the other donors that are there are only focused on an agenda that is missing tobacco control, injuries, violence, heart disease, renal failure, that is killing people, killing them prematurely, and an enormous fiscal burden on the country. And I speak strongly because it occurred to me recently, that's just not fair. That the dialogue is not, the door is not open to talk about this. So one, the country has little capacity, and two, they're boxed into what they can talk about, even if they realize they have a problem. It's not on the table. So countries, the most investment is needed at the national level. That's clear. And some investment is needed in prevention. In some countries, it's a public health emergency they need to invest in. Leveraging will also be important. Leveraging other dollars, leveraging poverty reduction dollars, conditional cash transfers, can they be leveraged to have some NCD element in there? Big infrastructure projects, can they be leveraged so that walking and biking gets put as a brownie point as an externality to that package? So those are some ideas, but I'm clear that some new money is needed to particularly help the weaker countries. So there are two sets of comments, one on messaging and one on money. And it's not impossible. Muskoka last year they put $7-point-something new billion on the table. If there's enough pressure, there will be money. And it could be innovative. It could be a mix of government. Challenge the private sector to match 1-to-1. If the Lancet is right and there's a $9 billion price tag, $4 million from government, $4 billion from the private sector, and $1 billion from Rotary. Or for some new way of using the global cell phone industry to text in your support and give 10 cents each time. So we need some. We need some new thinking. But we definitely need some money.
Thank you very much. Do we have any other comments or questions? We're getting towards the end of our hour here. Well, why don't we then close and adjourn, and please join me in thanking our 6 participant speakers here this afternoon.